How does a biopsy diagnose chondrosarcoma accurately? Imagine trying to identify a complex puzzle piece without seeing the whole picture. That's similar to how doctors diagnose chondrosarcoma using a biopsy. A biopsy involves taking a small tissue sample from the suspected bone tumor. This tiny piece is then examined under a microscope by a pathologist to look for specific cellular features. The goal is to determine if the tumor is chondrosarcoma, which is a type of cartilage-forming cancer, and to figure out its grade or level of aggressiveness. To get the most accurate diagnosis, doctors often use image-guided needle biopsies. This means radiologists use imaging tools like computed tomography scans or magnetic resonance imaging scans to precisely target the tumor. They insert a thin needle into the tumor area, guided by real-time images, to collect a representative tissue sample. This approach helps ensure that the sample reflects the tumor's true nature and reduces the chance of missing critical areas. The accuracy of biopsy in diagnosing chondrosarcoma is quite high, with studies showing about 86 to 90% correctness in grading the tumor before surgery. Differentiating between low-grade and high-grade chondrosarcomas is especially important because it influences treatment choices. For example, low-grade tumors tend to grow more slowly and may requiring less aggressive surgery, while high-grade tumors are more aggressive and often need more extensive removal. Several factors influence how accurate a biopsy can be. When a team of specialists, including orthopedic surgeons, radiologists, and pathologists, work together, the results tend to be more reliable. Radiologists guide the needle to the most representative part of the tumor, while pathologists analyze the tissue for cellular features like cell density, nuclear atypia, and mitotic activity. These features help determine the tumor's grade. However, chondrosarcomas can be heterogeneous, meaning different parts of the tumor may look different. Sometimes, the biopsy might sample a less aggressive area, leading to an underestimation of the tumor's true grade. While this can happen, it is relatively uncommon, and clinicians often consider imaging findings and clinical context to make the best treatment decisions. The microscopic examination looks at how cells are arranged, how abnormal they appear, and how actively they are dividing. Low-grade tumors show fewer abnormal features, while high-grade ones display more cellular atypia and increased mitotic activity. This detailed analysis helps doctors decide on the most appropriate treatment plan. In summary, a biopsy diagnoses chondrosarcoma accurately by combining precise tissue sampling with expert microscopic analysis. Guided by imaging and performed by a skilled multidisciplinary team, it provides vital information about the tumor's nature and grade. While some discrepancies can occur due to tumor heterogeneity, biopsy remains a cornerstone in diagnosing and planning treatment for chondrosarcoma. Always remember, for any diagnosis or treatment, consulting a healthcare professional is essential to get personalized care based on individual circumstances.